when I was in optometry school, we would work on a slit lamp and there would be a teaching tube. And you would go behind the oculars, you would do your evaluation, and then your proctor, your preceptor would look through the teaching tube to make sure that what you were seeing is clear and you were finding the anatomy and the physiology correctly. And one of the things I found that was kind of frustrating with that whole process was when you're in the teaching tube, it's monocular, so you're only using one eye. And as the lamp is moving, the tube is moving. And also, when you are clear in the ocular, sometimes the proctor or the preceptor is not clear in the teaching tube. It was really inefficient and kind of inaccurate. So when I was in school, I thought there should be a better way to do this. Some kind of camera situation that would be implemented into the slit lamp so that we can see what you're actually seeing through the oculars on a TV screen or a monitor. And after I got out of school and I started my own practice, I had gone through probably 5 different camera systems. One implemented into the slit lamp, one mounted onto the ocular, one mounted in between the oculars and the lamp, another one was mounted inside of the lamp itself, and all of these had their pros and cons, and the one that I like the best is the SLEYEcam. And the reason I like this the best is because the ones that clip onto the oculars, you are losing stereopsis. You're not able to see 3-dimensionally with both eyes. You're only using one ocular. With the SLEYEcam, it connects inside through a nice beam splitting aperture, and you will see everything stereopsis with 2 eyes, 3-dimensionally, and everything that you see will be captured onto a smartphone. And you can watch that in real time on your smartphone, or you could cast it onto a television or a monitor and watch it in real time. You also could capture it recording while you're doing the eye exam and then stop it and play it and speak to your patient outside of the lamp and pause it and go over all of the things you found, whether it's pathology, just basic anatomy, interesting findings like epicapsular stars or PPM. It allows you to work the slit lamp the same way you normally would work the slit lamp without having to sacrifice anything. Another thing I really like about it is using a smartphone and having a smartphone adapter that isn't templated for one specific phone. You have the ability to change phones. So whatever phone you're comfortable using, whether it's a Samsung or whether it's an Apple phone or a Google phone, whatever you like to use or use in your personal life now, you can use that phone and apply it to this SLEYEcam. And the learning curve is completely nil because you already understand how to work the phone that you use. Some of the other products, they require you to use the phone that they provide, or they require you to use a phone and you provide the phone, and then you've got to learn to use that phone if you already don't know how to use that phone. So I really like the fact that you can choose any phone that you would like. I prefer the Galaxy phone by Samsung. It has a great camera system, and it has a Samsung cast where I can cast it onto my TV here, as you can see in the background. I can watch the entire anterior segment or even the posterior segment if I'm using a 90 real time, or I can stop it at the end, pull the slit lamp away, talk to my patient and say, here are the findings that I found,